skin here. So I'm gonna kind of trace out where it is on you. Under your skin, which drives you crazy, it's right in the back of your neck. And we're gonna make a little, we're gonna try to make it, get it out of as small a little hole as we can. I don't think this one's ever, it's never been messed with before, never been squeezed out, right? Nothing's ever been, so hopefully that makes, it has been kind of a little bit?
Yeah, when I was in my 20s.
Okay. So when it's been squeezed a little, sometimes there's a little more scar tissue, so there can be a little bit tougher for us to get out. In other words, we gotta work a little bit more, but it looked pretty good from the, oh, except there it is right there, I see a little bit. So far, I try to, the goal for me is trying to get it out without it rupturing, because it's just so much prettier at that. Actually, I already think it ruptured a little bit on that side, but that's okay. It's still salvageable. You okay?
Mm-hmm.
That's got like a thin wall. It's really actually pretty friable here. So that means let's try to squeeze some of that out and make it a little bit easier to remove. Okay. And for that, I'm going to just push on you a little bit. You okay?
Yep.
Good. Go. Maybe a little bit more here. See if we can push more of it out. Thank you for that. They're always bigger than what they seem. Good. Let me try to get the wall out now here. Again, just make sure I'm not hurting you. So we have to, with all cysts, there's always a somewhat of a chance that they can recur because the sac has to be removed completely. If the sac is not completely removed, they can recur. That's why too, when it's been inflamed or kind of manipulated before, the sac maybe might break into pieces underneath there. So sometimes, or become what we call multiloculated. So that we have a less of a chance of getting it out completely. But this looks like it's nice and whole and well behaved.
Mm.
So just try to tease it out. There we go. That's the whole, that's the bottom of the sac. There we go, that's the sac here. So I'll show you in a little bit. I'll show you. Put that on the side. Take a little video of that too. Look nice and clean under there. I will double check with a little bit of Q-tips here, but we don't have to. Sometimes some people ask me if like we have to irrigate the wound or anything like that. We don't have to unless there's an infection there. I mean, and we don't do these unless there's an emergency if there's an infection. So you don't have to do anything like that because it looks like we got it all the way out, and we will give you a little antibiotics just because the sac was ruptured a little, and to be on the safe side, I don't want you to get a little infection. But yeah, there you go. You put a little suture in there, and you're done. That wasn't too bad, was it?
Not at all. You guys are good.
That was pretty quick, actually. That was a satisfying one.
Oh, good.
Not really oozing a lot at all either, which is great. Because they're really walled off. I mean, cysts don't have little blood supply per se, so they don't have their own little blood supply like that to create a lot of bleeding in the area. So we don't have to go lower to get bleeding. We usually are just fine.
That's amazing. That was done a long time ago.
Yeah, if you had known that it was going to be that simple, yeah. And it won't be, I mean, it might be a little sore tonight, but nothing that a little Tylenol can't cure. I'll get you for you.
They gave me a prescription for...
Oh, we did?
Yeah,
Okay,
so I started it yesterday.
Okay, good. Perfect. I forgot that I did that, so thank you. We don't need to give her that antibiotic then. Okay. She's got it. I didn't write that in your chart, so...
They look different than those, though.
Yeah. Yeah, maybe sometimes it's a little different brand even. Like they can look different. If one's a generic or a different company makes it.
It's to
There's
take
some
up
different
5
options.
days, is that right?
Yeah. Oh, I think you probably had a Z-Pack, yeah. A question I have for you is, Do you have anyone at home to help you remove these sutures for you? Otherwise, you can come see us. I just wanted to save you a trip if possible.
Really?
Do you have, because I don't think you can remove them. They're on your upper back. You can't see them.
Yeah.
Do you have, otherwise, we're happy to see you. I'm just trying to save you a trip if you, to come in.
My husband.
Do you think he'd be okay? Do you trust him to do that? I mean, you want to do
He's
this?
out in the waiting room if you want to.
Well, it's easy. You can actually explain it. I'll draw a picture for you. But you know, what I was going to say, and can use this, okay, is you wait 2 weeks and you just have to snip one suture. If you feel like, if you make an appointment, if you feel like he can't do it or he doesn't want to do it or anything, you just keep your appointment.
Okay. But
We'll show him.
Huh?
Yeah, we'll show him, like, he can come in and see it, like when
Yeah.
it's before you put a bandage on it.
Okay.
Just move this all out of my way.
He's a good doctor.
Good. He's a good person to help you keep you get bending
He's
better.
good.
Okay, good.
My kids always
He's
looked at
steady.
him. They didn't come
Oh,
to me.
really? Does he like to do this stuff actually?
He's really good at it. So.
Oh, good. It's always good to have one of those in the family.
Yep.
So I'm putting in this kind of a running stitch under the skin so that you can leave it in for longer. It gives the wounds, strength for longer. We're leaving it in for 2 weeks, but you won't get that little railroad track sign then, around it, the Frankenstein kind of look because of sutures that are in there for a long time.
And he.
So put a little bow. We're gonna show him.
Okay.
We'll bring him back and he can see it before we put a bandage on.
Okay.
Let me just see, this is all connected here, so I'm gonna loosen that up a little bit because it was pulled a little tight. Let me just make sure it's nice and loose. This suture, which is blue, is Proline's suture. It has a little bit of a elasticity to it, so if a wound gets swollen or so, it can stretch just a little bit to accommodate that, and that's why we could put this kind of stitch here, because we want to make sure it can stretch and not get too. Let me just loosen this a little bit. Make sure it's nice and straight, nice and flat. The contents out, and a lot of it came on. This is probably, I don't know, a third or a quarter of the stuff that came out. It comes out, a lot of it squeezes out. And this is the sac. You see there's a sac right here?
Oh, yeah.
It was contained, and this is the stuff that's in it. You see there's like a cheesy, yeah, that's just the cyst content. It's really keratin. So we got the whole thing out, which is nice and clean, with very little blood, and all this stuff is what came out, this kind of cheesy stuff here.
Amazing.
That's it.
You're
All done.
amazing.
No, you're amazing.